Ed Jones says 22 years ago, on the day before his 59th birthday, he was installing this door when
I just felt real funny all up in here and jittery and nervous.
it was his first heart attack, and in the 9 months following, he had 32 more.
I do a lot of meditating out here.
Some were minor, but he remembers at least one where he almost didn't make it.
Couldn't respond, I couldn't do anything. They had tubes down me and shocking me and whatever, and after a certain amount of time, I heard a male voice say, "Take it off, he's gone."
But nurses resuscitated him, and months later, he got a heart transplant. He says he's been going strong ever since.
I've cut small trees down, I chop wood, split wood.
16 years after Ed's transplant, his son Eddie Jones had his own heart surgery. Doctors replaced 5 arteries that were almost 100% blocked.
And the next thing you know, they push you into the operating room. And I remember the total isolation when they kind of shoved my gurney a little bit. And that was the most alone I've ever felt in my life.
Fear is a good motivator.
Eddie's son Ben says it was a wake-up call.
Walking with him around the hospital floor trying to get his strength back and seeing all the things he had to go through and having to put that pillow on his chest when he would cough.
6 members of their immediate family have dealt with heart problems, and that's a fact that isn't lost on Ben.
Yeah, the heart thing's scary. I mean, it's frightening to see them go through that and think, well, there's not another generation between me and them, it's me.
Ben's been on cholesterol-reducing medication since he was 30. He's now 37. And the challenge for the Jones men is to reverse the dangerous trend that plagues their family tree.
I'm a work in process right now to get back to a physical, livable state.
I try to exercise. I'm definitely not good at it. Laura stays on me a lot about that.
Cholesterol-free book.
Actually, Laura has been a very good thing for me because I eat a lot better.
According to the National Heart, Lung, and Blood Institute, about 1 out of 6 heart transplant patients survive 20 years or more, and Ed is one of them.
It was probably about 1995. That was about 5 years after I got my heart.
And he says if that's taught him anything,
Never say never. Never give up.
Joining us now, Zoe Jones, a cardiologist at the Medical Center of Central Georgia. And Dr. Jones, I'm assuming no relation to our beloved meteorologist, is that right?
That's correct.
Okay, so let's just start off by giving us an overview of what do we mean when we talk about cardiovascular disease?
Well, cardiovascular disease, cardio means the heart and vascular blood vessels. And the heart is a muscle. In fact, here we have a little model. In fact, it's pretty much sort of like the size of a heart. My heart's a little smaller because it's the size of your fist.
Oh, okay.
But this is pretty much the size of a functioning heart. You can see the muscle of the heart, and then you also see the blood vessels. The red are the arteries, and the blue are the veins. And when we get blockages in our arteries, then we can develop a heart attack that's in the distribution of this muscle right here. And then when you have enough damage that occurs, then you have very much a weak heart muscle that no longer does the job, which is to pump blood around the heart, around the body. So when people develop cardiovascular disease, that affects how they can live, whether or not they're short of breath doing activities, whether or not they get chest pain doing activities. Vascular, though, also means the rest of the blood vessels. So if we develop cardiovascular disease, it may mean that we're also susceptible of having strokes.
Okay.
You know, because of the blood vessels in our veins. We could have problems with walking because we've developed blockages in the leg arteries.
And there's certain symptoms, or I'm sorry, risk factors that put you more at risk for issues with the heart. Is that right?
That's correct. One of the major risk factors is diabetes, and one of the things that most causes diabetes is obesity. And so that's one of the big challenges for our whole country right now in terms of us taking care of ourselves is dealing with diabetes and obesity. The other risk factors, though, sedentary lifestyle, not exercising, smoking, of course, would be a very big one, and what we eat, and therefore that affects how our cholesterol is.
Now, we just saw the story of Ben Jones and his family.
Yes.
What role does genetics play into it?
Well, genetics play a very big role. There are some people who eat right, they've never smoked, and yet they still have heart attacks. And so getting your cholesterol tested to help find out if you're one of the people who has this problem is very important. And once we know whether or not our cholesterol is good or bad, then still we need to work on that, act on that, take medicines if we need to, and take care of ourselves.
So we only have a few seconds left, but just go over with us the symptoms that someone might feel when they're having an actual heart attack.
Well, particularly important is when somebody develops chest discomfort when they're active. And it's a tightness in the chest. Sometimes it feels like a pressure or fullness, and sometimes it radiates up into the neck or to the arms. And then when it gets very severe and it's occurring at rest and it doesn't go away, then you need to think about whether or not you need to go to the emergency room.
Well, thank you so much for joining us again, Dr. Zoe Jones, a cardiologist at MCCG. Thank you.
Thank you.